this video, I'm going to show you a way to help relieve pain and tension in your neck and shoulders. Now, one of the most common causes or origins of neck pain and stiffness is anterior weight bearing of the head, also called forward head posture. This occurs when your head gravitates forward of your spine. And I'll show it to you here in this model. This is the model of a cervical spine. This is the front and this is the back. And this bungee cord represents your posterior neck muscles. If you reach back there right now and kind of feel it, there's one on each side, and it feels a bit round. It may feel a little sore, it may feel rigid, and this is actually your upper trapezius, or the upper shoulder muscles, because those muscles attach to your neck as well. So when you have a nice curvature, a nice arc like this, there's some slack in that muscle. But as the head gravitates forward from poor posture, look at that bungee cord. See how that stretches? And then the shoulder muscle here stretches as well because it's attached. And in some people, I've seen this on x-ray, is that not only do they have a flattened curve, it actually bends the other way. There's a sharp kink in it. So this changes the dynamics of the joints in your cervical spine. There's a lot of pressure placed on the discs. If that's allowed to persist, it dehydrates them. That added pressure dehydrates your discs, thins them out, weakens them, predisposes them to disc bulges, disc herniation. So what you want to do is do exercise and stretches that bring your cervical curvature back. It's called the lordosis. And if you could achieve that, you'll remove significant pressure and strain to your neck muscles and your shoulder muscles. Now there's a device that I use personally and I recommend to patients to help them rehabilitate their cervical spine if they have lost that curvature and need to regain it. It's called the Posture Pump Spine Trainer, and I'm going to demonstrate to you how that works. Now this is the Cervical Posture Pump Spine Trainer. So if your neck is straight and flattened out like this, you lie down on this thing, and immediately, even without the use of the air bladder, it puts the neck in a nice gentle arc. So what you do is you lie down on it, put your fingers on either side of the bladder to make sure there's equal spacing. Otherwise you may be too far to the right or too far to the left and you won't get a good stretch. It actually should feel somewhat good because you should feel an immediate decompression. For those who have a very rigid, stiff, straight, or reversed curvature neck, it may feel like there's some resistance there. So the first week or even 2 weeks, you'll just lie down on top of it like this for a few minutes to up to 10 minutes. As your spine gets acclimated to it, you could start using the hand pump. So this is what it looks like pumped up. And 4 pumps is a pretty intense stretch on its own. Okay, and let the air out. Now the next level of intensity is using the head strap. The proper way to sit up after you have completed a session is to, first of all, remove the harness and take a few deep breaths and relax your neck. And be mindful of your neck muscles, how they feel. Take your right hand or left hand and reach around the base of your head and use your arm muscle to help you lift your head off the device, like this, as you come up. So that's how you use the Cervical Posture Pump Spine Trainer to help restore that normal curvature in your neck and hopefully relieve some of the muscle tension that you might be experiencing in your neck and shoulders and mid-back. If you want to get one on your own, I have a special offer. Just click the link above here that you see. Now with all exercises, check with your doctor first. If you notice any strange or unusual symptoms, notably dizziness, weakness, or anything out of the ordinary aside from minor discomfort, stop immediately. The posture pump is generally safe. I do recommend that you consult with your doctor first before using.